Hi, my name is Jennifer George. I'm a third-year medical student at the University of Buffalo. The project I'll be speaking with you about today is healthcare workers and acute malnutrition. This project began about 2 years ago when my colleagues and I went to Malawi to work on several projects regarding acute malnutrition, chronic malnutrition, and health education. It was found, upon research of the country, we found that 4% of Malawian children less than 5 years old are acutely malnourished, and this leads to about 23% of the child deaths within the country. We also found that children within rural communities have very little to no access to medical care. So a lot of these children go unnoticed, unrecognized, and untreated. According to different articles and various research projects, it was found that there's one doctor for every 88,300 people within Malawi. So it is very easy for these acutely malnourished children to go unnoticed and untreated. So our goal is to bridge that gap. Our goal is to train local community healthcare workers to go into their own communities, into their rural villages, and recognize children as acutely malnourished and bring the treatment to them. Our proposed plan or solution on how to accomplish this is that we will partner with an organization called Naturally Africa Volunteers, which is based out of Nkopi, Malawi. Naturally Africa Volunteers will partner with us to recruit local community healthcare workers, and once we recruit them, we will train them on how to identify and treat acute malnutrition. Once they are trained, they will then be sent into their communities, and once they have recognized the child as acutely malnourished, they will report back to NAV. NAV will then partner or facilitate a partnership between the local community healthcare worker and a Malawian healthcare professional in a larger city or in a healthcare facility. That healthcare professional will then function as the local community healthcare worker supervisor. The local community healthcare worker will be trained on how to manage acute malnutrition and how to properly feed and monitor the progression of the child, as this is a very precise task, and they will do that on a daily basis, keeping logs of the child's nutrition. Weekly, they will report back to their supervisor about the child's progression and improvement, as well as the child's nutritional status, and the healthcare worker can visit the child if they deem it's necessary. Based on our data that we have collected, about 5.1% of children in the 3 neighboring villages around Nkopi are found to be severely malnourished. We are hoping that by training about 20 local community healthcare workers, we are able to reduce the rates of mortality due to acute malnutrition in these 3 villages. Another piece of supporting evidence is that it has been found, according to UNICEF, that 80% of children with acute malnutrition who are treated with RUTF are successfully treated with RUTF. So we know that by training these community healthcare workers and identifying those who are acutely malnourished, bringing the treatment to them, we will be successful in reducing mortality. Of course, there's no cost to training these local community healthcare workers because they are volunteers, and they are interested in lowering the rates of acute malnutrition within their own communities, but there is a cost to the RUTF. So what we are looking for is funding to supply NAV with RUTF so that NAV can then supply the local community healthcare workers with the treatment that they will be giving to the child. So we are hoping to establish connections with various organizations and hospitals within Malawi to give us that funding to give RUTF to these children. So once again, I want to thank you guys so much for letting us speak about our project and about everything that we're working on, and I hope that we can partner together to bring treatment to these children. Thank you.